Hello, good morning to everyone. I am Elango from Trichy. I am going to take the class on basic life support. This is most important for the nurses, medical students, and also for the paramedical students. They should attend these cases immediately to rescue the people, to save the life. Now the topic is about the basic life support. My all videos for about only 10 minutes videos. So it gives some short and sweet informations and solid points to you. So if you want, you can take a notes, or you can freeze this video and you can write and take the notes. Let's go to the topic now. This is basic life support. You can see this is the time for the emergency and it's critical in starting CPR. So you can understand by seeing this, within 4 minutes the brain get damage begins. Within 10 minutes the brain death is unavoidable. So the first 1 hour is most important for the victim and to avoid the further damages. So you should revive and give the CPR before 5 minutes. So to do the CPR, you should know certain basic ideas about the CPR. For adult, above 8 years is adult. Airway is most important. Assess the patient's conscious level within 5 to 10 seconds. Activate the emergency medical system, that is EMS. Phone first for the adult and phone last for the below 8 years. Okay. Getting help is the first for the adult. Getting help is the last for the below 8 years clients. Guidelines is always better you keep the patient in a supine position. One rescuer sit perpendicular to the victim's sternum and face the victim. The two rescuer, the first person sit perpendicular to the victim head, the second person opposite side and face sternum. Airway is very important. Head tilt and chin lift is the basic procedure before giving the CPR. This is for the neck injury patient. You should not do that, and if the foreign body is there, you should not touch the neck. You find out before, and at the time of assessment you should see all those things. Let's go to the next slide. This is actually a call for help. You can just raise your left hand to call the help, and right hand just touch the patient to feel and examine about the patient condition, and make the patient into supine position always. So turn the patient to right side, make the patient into supine position before giving CPR. Then you can understand by seeing this photography. The first film shows there is an obstruction in the nasopharynx by the tongue. Then the second photography shows the head tilt and chin lift. By means of doing this procedure for the victim, then automatically the tongue fall back will relieve, and the airway will be very clear to take a breath. There is another procedure by the first aider. The first aider may be the doctor, maybe the nurses, maybe the paramedical, or sometimes maybe the general public. So all must understand before giving the CPR to the patient. Head tilt and chin lift. This is the basic procedure. So see the first aider's left hand. She is just tilting the head, and the left hand is lifting the chin. Head tilt, chin lift. In this picture you can see the first aider holding the both side of the mandible with both hands, and the thumb is just on the mandible, and both 4 fingers are just under the mandible. This gives some head elevation, and it prevents tongue fall back too sometimes, and give a free way of breathing. So this is called jaw thrust maneuver. Jaw thrust maneuver. This is mouth to mouth rescue breathing. The first aider is holding the nose of the client with the left hand, and by means of the right hand, the first aider palpating the arterial pulse in the sternomastoid. Just medial to the sternomastoid, there is a carotid artery. The first aider is feeling the pulse. At the same time, simultaneously, the first aider giving the mouth-to-mouth respiration through her mouth, and open the patient's mouth, close the nose of the patient, and just seal the mouth with your mouth, and you should take a deep breath before that and blow into oral cavity. That blowing should not be leaked by the patient's nostrils. Before that, you should close the nostrils with your left hand, and simultaneously the head should be tilted and chin should be lifted. So in this position, the air entry will be very good, and simultaneously the first aider watching the chest movement for the air entry. And you just see this picture, mouth to nose breathe. This is mouth to nose breathe. Here the first aider is just holding the head tilt and chin lift, and simultaneously the first aider holding the face with both hands and blowing the air into the nose without leaking through the mouth. So mouth is fully closed by the first aider's right hand. You can see this, and you can blow into the nose, and you can feel the same lung expansion by your view on the chest of the client. This is the way to locate the carotid pulse. Already I have explained about this, and the first aider should use their two fingers to feel the carotid pulse. Carotid pulse is the major pulse in the body. Those who collapsed, that can be palpated only by the carotid pulse, because the peripheral pulse sometimes may be collapsed sometime. So better if feel the carotid pulse by your two fingers. You should keep the two fingers just medial to the sternomastoid muscle. There is a major arterial pulse you can feel by your two fingers. That is called carotid artery. But the important instruction here for the first aider is the first aider should hold any one side of the carotid artery. They should not hold both sides of the carotid artery simultaneously. It is very important, because this carotid artery supply the blood to the brain. So you should not obstruct that, and feel the pulse and check it. This is the examination before giving the CPR and external chest compression. Locating the rib margin. Use your two fingers to locate the rib margin, and along with the rib margin you go to the middle portion of the chest. You can feel the sternum. The tip of the sternum is zippy sternum. You should feel the zippy sternum, and then this is the feeling of zippy sternum, and find out the sternum for the external chest compression. Locating the notch of the sternum. And then what you have to do is, the first aider should keep the left hand on the sternum. Better keep your hand on the lower 1/3 of the sternum to give the chest compression, external chest compression. Keep your left hand. The into mark shows in the picture. That's here. You should keep your left hand. That is actually lower 1/3 of the sternum, and keep your right hand on your left hand. Like this, and just lock your fingers with your both hands, and your hands should be 90° straight away to the sternum for the external chest compression. You can see this picture. This picture reveals a better position of the client, and better position for the first aider to sit. So in straight away 90°, the elbow, the hands and the shoulders should be in the same line. The first aider should be kneel down if the patient is lying